Senior isolation has been an ever-present, ongoing issue that has tended to be shrugged off by the general publics of various nations and cultures. In most Western societies, senior citizens are defined as those who are between the ages of 60 to 65 and older. According to a 2018 article by the AARP, there is approximately 45 million Americans who are aged 65 and older. It is predicted by 2030 that number will reach 73 million. The National Institute of Aging states that structurally, social isolation is the absence of social interactions, contact, and relationships, which can be caused by lack of family presence or support, passing of close friends, having impaired mobility, and other factors.
Like I see more like flat affect when we approach during an interaction, like not really much expression when we were interacting, and not talkative, just sleeps more than usual, and not motivated to get out of bed. It's like more declining, diffuse when we offer something.
2018 AARP study highlights the severity of isolation by equating its effect as posing the same risk to one's health as smoking up to 15 cigarettes a day. Social isolation can also lead to depression, anxiety, Alzheimer's disease, heart disease, and an increased proclivity to physical ailments such as the risk of cancer. Now, with the uncompromising presence of COVID-19 changing the lives of many people across America, the situation has only gotten worse within the senior population. Since the start of the pandemic, a death toll of over 85,900 lives has been accounted for with COVID-19, and there have been about 1.5 million confirmed cases as of May 2020. To reduce the spread of the virus, state governments have ordered a shelter-in-place to be implemented. The shelter-in-place mandates people to remain at home unless they have an essential reason for going out, and different states have placed it at different times. Amenities such as public libraries, houses of worship, neighborhood cafes, and other places that can potentially foster social engagement for seniors have been forced to close under these precautions. Essential facilities such as senior centers also had to adapt to these precautions by canceling group activities such as bingo, exercise classes, and other social activities. These new conditions have further exacerbated the isolation among senior citizens.
Totally isolated from the community that we usually open like dining room for people who are able to be up in a wheelchair and go, and then we have like 4 different dining room but in the facility, but they were all closed. And they also have a activity room that people go and do the music or game or movie or something, and that they were able to interact with other residents besides family and friends from the outside. So they were all shut down with all these.
According to an article from the New York Times, before the pandemic, 30,000 elders throughout New York City use these facilities on a daily basis to assist in an increasing social interaction among the elderly population. And now, those 30,000 elders are at a greater risk of isolation and its adverse health effects. Sarah Rico, a New York City native who visits Sunnyside's community services on a daily basis for photography, group exercise, mental health classes, and lunchtime meals, has expressed that the closing of the senior center has dealt her a great deal of stress, modifying her way of living. Rico stated that the situation has been more isolating for her, a situation that has, unfortunately, become the reality for many other seniors as well. Within nursing homes, these precautions have been implemented, as they are the most vulnerable, Elderly patients and long-term care facilities have had to adapt to these new challenges to counter the spread of the coronavirus. The CDC has instructed nursing homes nationwide to cancel all planned group activities, including group dining, by substituting individual room meals and to enforce social distancing among residents. They have advised to separate residents who are suspected or confirmed to be infected.
So they were more forced to stay in a room most of the day, and they do get agitated, frustrated, more yelling, screaming.
The only people allowed to enter the facilities are essential staff personnel. If a patient with COVID-19 is not expected to live for more than a few days or weeks, a family member may be allowed to visit their loved one, but that is not always the case. The outcomes from these hardships make them more prone to isolation and loneliness. Don Carr, a Florida State University sociology professor, states that not only are they being faced with a situation where they really shouldn't leave the house, but in many cases, they're far more likely to live alone. They're less likely to have access to many of the connections that younger people are using, like Zoom and online ways to connect with others. So they're at magnified risk relative to others with regard to social isolation.
And then one of the residents, they on the Mother's Day, they came have window visit by family. She recognized the family once she sees them, but she didn't understand why they have to be outside the window, and she really wanted to go outside, and then she started become really upset, and we try to explain, but she obviously not understanding what is really going on, or if we explain it, she understand, but next maybe hour or 2 hours, she doesn't retain the information. Whether they realize or not, they're just not getting all this interaction with people, like they might feel anxious or depressed or something, and they might not say it, but then there's all kind of emotional going on, I can see in their behavior.
Since health officials have structured these facilities to place restrictions on gatherings, residents are not able to spend time with each other and partake in group activities or social events. So where does that leave them? Pretty much in their room, and they're cut off. I'm sure it's scary.